Colon cancer is a malignant tumor located in the large intestine and has an epithelial origin. It develops from the glandular epithelium, the intestinal mucosa. The asymptomatic course of the disease often leads to the fact that a person detects cancer at a late stage. Most often, due to the large amount of fats of animal origin. The production of bile increases, and this directly affects the intestinal microflora. When fats are broken down, carcinogenic substances are formed, and they provoke the development of colon cancer cells. The main risk factors for colon cancer are: age 60-year-olds get sick 20 times more often than 40-year-olds. A diet with a predominant content of animal fats, proteins, and refined carbohydrates increases the risk of getting sick 7 to 8 times. Diabetes, the risk of getting sick is 15%. Gallstone disease, risk 13%. Radically cured of colon cancer, risk 13%. Hereditary factor, about 20% of cancer cases occur within the family. If a first-line relative has colon cancer, the risk of developing it doubles. Precancerous diseases, adenomas, polyps, of the large intestine, risk of malignancy, from 10 to 50%, depending on the size of the adenoma. Nonspecific ulcerative colitis, Crohn's disease, other colitis, the risk of malignancy is up to 50%. Gradually, minor symptoms can be observed, for example, appetite and well-being deteriorate. Activity level decreases, and weight may increase. Symptoms of colon cancer depend on the localization of the tumor, as well as on the size and presence of complications. As practice shows, complications of colon cancer can occur due to incorrect or untimely diagnosis, so it is very important to understand what methods of researching the disease exist. Main methods: biopsy, histological examination of tumor tissue taken during colonoscopy. Colonoscopy, endoscopic examination of the intestines using a special instrument with a camera is performed with and without anesthesia. Rectomanoscopy, visual diagnosis using a special device is suitable for primary diagnosis, as not all sections of the intestine can be examined. Irrigoscopy, X-ray images that allow you to determine the location of the tumor. Computed tomography, it allows to detect the affected lymph nodes, distant metastases and determine the tactics of treatment. PET CORT, it is carried out to clarify the localization and spread of the tumor development process. Ultrasound and MRI of the abdominal cavity of organs. Laboratory research, it is important to contact the clinic for diagnosis at the slightest suspicion. Proper and timely treatment will help to overcome the malignant formation. In case of colon cancer, the type and extent of surgical intervention is determined by the location and spread of the tumor process, the condition of the regional lymph nodes. In advanced stage 3 IV colon cancer, extended surgery is performed: intestinal resection, hemicolonectomy, removal of half of the colon. Colonectomy, removal of the entire colon, with wide lymphadenectomy, removal of regional lymph nodes. For stage 1-2 tumors, early stages, economical resection of the colon is performed. Endoscopic removal of both benign and malignant tumors of small sizes is widely performed. Chemotherapy is used if the operation does not allow to completely remove the neoplasm and the cancer cells have already entered the lymphatic system. In order for the state of health to gradually return to normal after the colon tumor treatment, it is important to properly organize the postoperative period. The doctor determines the scheme of further treatment. All patients who have undergone surgery must be examined on a regular basis, monitor the slightest manifestations of any symptoms, in order to avoid recurrence.